Good afternoon. We are going to do an instructional video on the areas that you can inject your horse with Summit. So these are IM injections. The first area that we're going to go through is the neck. So this is our horse's neck. This is his shoulder. And this is his cervical vertebrae. So we're going to tape it off so it's a little easier for you guys to see. So his cervical vertebrae or spinal column runs right there. The front of his shoulder is all cartilage with very little muscle, so you don't want to go into that. So we'll tape the front of his shoulder. And you should be able to feel the bony part of his shoulder right here, so you want to go right in front of that. And then the top part of their neck is the nuchal ligament. So it's a ligament that helps them hold their neck up since their cervical column is so low here. And we're gonna avoid putting it in there because anything that you put in the ligament does not get absorbed, so you don't want to put it there. So anywhere inside of this triangle is a good area to do your injection. The other thing I like to do is I like to put my hand on the shoulder mark here and spread it out, and wherever my middle finger is a good place. So anywhere in this area has got a nice big belly of a muscle, and you can give your injections there. I'm gonna pull one up for you. So this is our bottle of Summit. This is our needle. The needle inside the middle of the gray plunger. Turn the bottle upside down and draw it out. Now to get every last little bit out of the bottle, you sometimes have to turn the needle a little bit sideways for those couple last drops that are sitting inside the stopper. And then what I like to do is to take the needle back off the syringe, tent the skin a little bit because it'll dull the sensation of the needle going through the skin. Stick the needle in, make sure there's no blood coming out of it. Pull back just once to make sure again, and then just slowly push it in. So there's other areas that you can inject your horse to if you don't want to use the neck, or if for some reason horses are getting multiple injections. You can use the pecs, which is this muscle right here in the front, and go right in the center of it. It's not the best place to go because they can swell a little bit from there because there's some fat to that as well, and you need this to go into the muscle, but that is an alternative site. And the other place is in his rear end. Just scoot him over for you. Perfect. I'm gonna come right here. So there's a semimembranosus muscle that's right here, and there's a small definition between the muscle belly here. If you want to just kind of grab that with your hand and stick them right in there, you can stick it right in anywhere along this big muscle belly and this big muscle, and that'll work as well. Just be careful to stand off to the side, obviously, if you're going to stick them, just in case they jump up or maybe kick out a little bit, and then you can put in your needle in.